Hi, everyone. I'm Dr. Lily Baruch, and I'm the Director of Sports Cardiology at Johns Hopkins, as well as a member of the HCM Center faculty. I'm sorry I can't be there in person, but I wanted to talk to you today about exercise and sports participation in hypertrophic cardiomyopathy, about some of the updated guidelines for staying active and living with HCM. This is actually a really exciting time for exercise recommendations regarding HCM because a lot has changed over the last few years. I'm hopeful that many of you have already heard about some of these exciting changes, but if not, then that's what we're here to talk about today. I wanted to give you a little timeline of the history of how this all came about. So back in the 1990s, which was a long time ago now, autopsy studies showed a high rate of HCM among athletes who died suddenly. And it was just kind of assumed that it was the competitive exercise that was causing the increased risk. This led to a series of very restrictive guidelines that were placed on people with HCM to restrict them from competitive sport participation. So the 2005 Bethesda guidelines, as well as the 2011 AHA-ACC guidelines, really placed very significant restrictions on people with HCM in the type of physical activity that was recommended. So it was based on some of these older data that we know that HCM affects 1 in 200 to 500 people in the United States, but there's a wide spectrum of disease. Initially, the recommendations were based on a lot of assumptions and were applied to everyone, no matter how severe a disease they had. And it was thought to be a leading cause of cardiac arrest in young athletes. Here's another older study of almost 1,900 athletes between 1980 and 2006 that showed that HCM was one of the leading causes of cardiac arrest in these tall bars on the very left of this graph. But keep in mind that HCM is a lot more common than a lot of these other causes. So within the general population, a lot higher number of people have HCM than have some of these other conditions, such as ARVC or some of the rare types of cardiomyopathy that can also lead to cardiac arrest. So of course, there are more people who had that just because there are more people who have HCM. So what happened after these guidelines were put into place is that people began to develop high rates of things like hypertension, coronary disease, obesity, basically diseases of being sedentary. Not surprising, you tell a whole bunch of people that it's dangerous for them to exercise, and then they don't exercise and they develop some of these other problems. So the 2011 guidelines had restricted people with HCM pretty much from all competitive sports. So although it was usually allowed for people to play low intensity sports, these included only a few things such as golf and bowling. Nothing against people who like golf and bowling, but it excluded most other team sports, most other individual sports. And it was even considered harmful to allow people with HCM to participate. And the guidelines came out saying this at the bottom: patients with HCM should not participate in intense competitive sports, regardless of any of these other factors, whether they were older or younger or had more severe disease or less severe disease. And this remained a pretty blanket prohibition for quite a number of years. So how did we get from those 2011 recommendations until the present? Jared Butler, who's a player in the NBA, who's living with HCM, was found to have this. And after a number of high-profile cases of people who had a cardiac arrest with HCM, he became one of the first star players to be allowed to continue to play, and the types of conditions that were put into place to allow him to do that safely. He really became a spokesperson for the process of shared decision-making and allowing people to continue to play safely. So as time went on in the sort of 2015 to 2017 range, multiple small studies started to come out showing the benefits of exercise in HCM, with increasingly vigorous exercise in these various studies, as people began to see that perhaps we had been making assumptions about exercise that were not correct for people with HCM. So we know that the guidelines were leading to a reduction in all physical activity and resulting in having diseases of being sedentary. We also noticed that a lot of people with HCM who did have a cardiac arrest were not necessarily only having cardiac arrest during or immediately after exercise. Most of the cardiac arrests happen while people are at rest or doing other things. So some of these newer small studies were showing that different types of exercise were actually beneficial. And we began to realize that there are really no data that were supporting the concept that vigorous or even competitive activity was actually detrimental. it was assumed that because of the association of high levels of activity with cardiac arrest, but particularly in HCM, it was not necessarily the only factor that was causing problems. And the risk of cardiac arrest in HCM as it relates to the intensity of activities was really not studied. It had been based on a lot of assumptions. And so several of these newer studies in the sort of 2015 to 2017 range began to show that exercise might actually be safe for some people with HCM. So fast forward then to the 2020 guidelines. These are not the newest, but the one prior to the newest guidelines started to have different wording for the first time. And we saw that for most patients with HCM, mild to moderate intensity recreational exercise is beneficial. Well, this is the first time we have a recommendation that actually recommends exercise for HCM patients specifically, and that people who are gene positive but don't have any phenotype, meaning they don't have any wall thickening, they don't have any arrhythmias, they just had a gene test that said that it was positive, but their hearts look normal, don't need to be restricted. And last but not least, for people with HCM, participation in high-intensity recreational activities or moderate or to high-intensity competitive sports may be considered. This is the first time we see in the recommendations anything other than a complete prohibition on vigorous exercise. So this is a pretty big deal. And then the tide starts to shift in terms of how we recommend physical activity to people who are living with HCM. Until 2023 was kind of the big splash when a big study called Live HCM came out. This study was called Vigorous Exercise in Patients with Hypertrophic Cardiomyopathy, and it studied 1,660 patients from high volume HCM centers of a pretty wide range of ages, and they were asked about their levels of exercise and categorized into 3 groups, whether they were sedentary, did moderate exercise, or vigorous exercise. And the main question that this study asked is vigorous exercise associated with an increased risk of mortality, of dying, or of abnormal rhythms in individuals who have HCM? And the answer was a pretty resounding no, so that there was not really an increased risk. And to some people who take care of HCM patients, this was quite surprising because this really kind of went against a lot of assumptions that many people had for a long time about what it means to have HCM and what the risks are. The main conclusion of this study was that individuals who were engaging in vigorous exercise did not experience a higher rate of events compared with a non-vigorous group. And this really made big news, and this really changed significantly the way we think about exercise recommendations for HCM patients. So here are the 2024 guidelines where they've been revised significantly. So these are the guidelines that just came out last year from the ACC and AHA. For patients with HCM, participation in high-intensity recreational activities or moderate to high-intensity competitive activities may be considered. And for people with HCM who are capable of high levels of physical performance, participation in competitive sports may be considered. Now, this doesn't mean everybody. These are generally people that are lower risk, but who have HCM, who are doing competitive activities without symptoms and who don't have abnormal rhythms. But this is a really big deal for people who don't have symptoms to not have a blanket prohibition. And then also for the first time, we have here a specific recommendation for exercise, not just that it's allowed, but for most patients with HCM, universal restriction from vigorous physical activity is not indicated, meaning that the default should be that people should exercise and that only people who have high risk would be prohibited. The sports cardiology guidelines specifically also address these issues and are similar to the new AHA-ACC guidelines. The sports guidelines came out earlier this year, stating again that competitive athletes with a positive gene test for HCM, but without a clinical diagnosis, can participate in competitive sports. They should not be restricted. And it's also reasonable to consider competitive sports for athletes with HCM after a comprehensive assessment and shared decision-making in which the risks and benefits are discussed. So this is really big news in the world for athletes, but also for people with HCM who are not very athletic, but who want to be more active, that there's a lot more leeway and a lot more not just allowing people to exercise, but recommending exercise. One thing that's happening, though, is that people are sometimes afraid to exercise, especially people who were diagnosed when the recommendations were very different. And we're starting to have an approach to exercise prescription to help people become more active in ways that are safe. We think of these in kind of low, moderate, and high risk categories. So people that are low risk, who are asymptomatic and who have good functional capacity, they can do their day-to-day activities and not really have any symptoms, are generally safe to exercise. Now, this should always be done in conjunction with your doctor's recommendations. But if there are no red flags, then the people who are in that situation can often be cleared to do high intensity exercise. People who are kind of in the middle, who have some mild symptoms or some features that might put them at moderate risk, can still exercise, but at a more moderate intensity. And people who are higher risk, who have a history of significant rhythm problems or who've had a cardiac arrest in the past, are generally considered high risk and would be still recommended to stick with low intensity exercise, but not no exercise. We want everybody to be active in a way that's safe for their level of symptoms and their desired activities if possible. A little practical guideline here for people that aren't as familiar with how we categorize mild, moderate, and vigorous intensity. There's a calculation for your maximum predicted heart rate. Now, given that this is a very rough estimate and also some of the medications can affect your heart rate, you should always work with your doctor to help figure out if you want to know more about what level of exercise you're doing. Light is usually 40 to 50% of your maximum predicted. Moderate is 50 to 70, and over 70 would be considered vigorous. For example, for a 40-year-old, light exercise would be a heart rate around 72 to 90, moderate would be 90 to 126, and vigorous would be over 126. Again, these are just rough guidelines, and I often have people go more by their how much exertion they perceive. Does it feel light, moderate, or vigorous? May actually be a better estimate. Again, we work with people all the time to develop these ranges, often based on how they feel, but sometimes with heart rate as a guideline as well. So overall, this is really exciting news for people with HCM in the world of exercise to stay healthier. So how's it going now? We've really come a long way over the last 20 to 30 years, from almost universal restriction from anything other than low-level exercise to allowing people with HCM and encouraging people with HCM to remain active up to levels that were really kind of unheard of previously. Now, this doesn't mean that people who have a lot of symptoms can just go out and do whatever whatever people who don't have symptoms are doing. There still needs to be a shared decision-making process to find ways of doing these things safely. And in that light, I wanted to give a little plug for a research study that I'm doing with Dr. Kellen Knowles and Dr. Evan Osuji. One of them should be in the back with flyers, and there should be a flyer in your packet as well about this research study in case there's anyone here who might be interested in participating. We know that the exercise practices of people with HCM have been changing and that there are some barriers to people engaging in exercise. We're trying to develop safer ways to develop exercise prescriptions and also using some modern technology such as wearables, smartwatches, and things like that to help guide physical activity for people that are participating, maybe doing exercise for the first time in many years as well. If you're interested in this study, the first phase is just a survey, and you can participate by signing an online consent form and then doing the survey online. The second phase is a cardiopulmonary exercise test, which will be done in conjunction with a smartwatch or other wearable device to help guide exercise for a couple of months after the test is done. So this is a QR code that leads to the study webpage. There also are flyers in your packet, and there's some consent forms on paper in the back if you're interested as well. So thank you all very much for your attention. If you have questions, you can ask Dr. Madrazo or one of my colleagues who's there in person. If you want to ask me a question directly, my contact information should be available, and I'm happy to answer any questions by email or if they're addressed to me by telephone as well. Thank you to the Leibowitz Family and Talus Fund for their support of the HCM program, and I hope to be able to see you in person next time. Take care. Bye-bye.